Hello, and thank you for your interest in our recent publication, Unmet Needs in Treatment Escalation for Chronic Spontaneous Urticaria, Findings from the Cure Registry. On behalf of all co-authors, I will run you very briefly through all the main messages of this publication. So first of all, why did we do this study? According to international urticaria guidelines, we need to start treatment of patients with chronic spontaneous urticaria with second-generation H1 antihistamines at a standard dose as a first-line treatment. We can, of course, increase the dose, and then, if they are not effective enough, we can add omalizumab, which is a second-line treatment, and then at a later phase, we can also switch to cyclosporin, which is immunosuppressant. However, unmet clinical needs in treatment escalation and treatment patterns of patients with chronic spontaneous urticaria in the real world are poorly investigated. That's why we analyzed data of almost 4,000 patients with chronic spontaneous urticaria, adult patients from Chronic Urticaria Registry Cure from 57 centers across 28 countries, and who were followed up over 6 months. So, what are the main messages of our publication? First of all, appropriate treatment escalation can improve CSU disease control. So if you switch from no treatment to second generation antihistamines, from antihistamines to up-dose antihistamines, or to omalizumab, you will see the increased rate of complete responders or responders to treatment in general. However, many patients do not achieve well-controlled or completely controlled CSU. Moreover, about one-third of patients who are clinically eligible for escalation, meaning that they have urticaria control test less than 12, they do not receive guideline-recommended treatment escalation and remain symptomatic on their current treatments. And what are the factors associated with the lack of escalation? These are younger age, shorter disease duration, presence of angioedema, better quality of life, and up-dose antihistamines. And we identified several unmet needs. So first of all, we need to better understand these patients who are refractory to available treatments, better understand the pathogenesis of chronic spontaneous urticaria, better understand CSU endotypes and phenotypes. We need better educate physicians and patients. And then finally, we need novel treatments. Thank you very much for your attention. Please check the entire publication, and we would love to get your feedback on this report. Thank you so much.